with the mechanical pain, we've talked about how the pain has certain features, that it's worse with activity and better with rest and recumbency. To identify those patients who have systemic disease, there are certain red flags. For example, there are red flags that might suggest to you that there may be underlying infection or malignancy, and these red flags are a patient who is over the age of 50 or 60, a patient who has had fever and chills, significant weight loss, a patient who gives you a history of having had cancer in the past, patient who is having nocturnal pain, pain which occurs at night. So these are red flags suggesting to you that there may be the possibility that there may be underlying infection or malignancy. On the other hand, you may have a patient with another systemic cause, a spondyloarthritis. These people have inflammatory low back pain. This is the back pain that is associated with prolonged early morning stiffness that lasts for more than half an hour. Their pain is not relieved by rest, and in fact it's relieved more by exercise. These patients frequently have nocturnal pain, and they may even complain of alternating buttock pain. So because these systemic diseases have a specific, well-defined cause, and if you don't take care of the problem rather quickly, it can lead to a problem. It could lead to further problems downstream. For example, if a patient has nerve root compression, let's say from cauda equina, you have to do a careful neurological examination. You have to find out if there is a neurological deficit. A patient with cauda equina, for example, will often have severe back pain, will have bilateral sciatica, may have anesthesia in the saddle area, may have urinary retention with overflow incontinence. If you don't urgently surgically decompress the patient, there could be lasting neurological deficit. So the quicker you decompress him, the better the outcome. And the same goes for a person, let's say for example, who may have vertebral osteomyelitis or a spinal epidural abscess. If you don't treat these things urgently, the patient will certainly get much sicker.